So again, this is again a picture, and I think it is very instructive here. So you look at thick calcium, you can't really see anything. If you have a thick, these are corresponding images, IVUS and OCT. On the other hand, if you have thin calcium, you can see these reverberations. So you can look at this and you can think, oh my God, will my stent expand or not? This is a big arc of calcium all around, but if you are seeing reverberations here, you think that probably it will. And the easy way to find out is actually inflate your balloon and see that whether the balloon inflates or not before jumping into some kind of serious calcium modification. This, on the other hand, is less likely to be modified by balloon dilatation. What will happen is if you inflate your balloon, it will expand in this direction. You will get a stent expansion in this case, but it will be sort of an eccentric expansion. So target lesion detection, calcium detection, angiography versus IVUS versus OCT. I think we have already said this, but I will read out the summary. Evaluating in a contemporary imaging study, this is again Wang and Matsumura. Target lesion calcification assessment via angiography versus IVUS versus OCT across 440 patients. With stable angina, 30.2% of IVUS detected calcium. Calcium was either not visible by OCT or was underestimated by OCT, mostly due to superficial OCT plaque attenuation. So this is an important thing. There are some images in OCT, and we have faced this, where you think, what is this image? What am I looking at? And because you won't be able to see the classical images that I showed you, like this or like this, concentric calcium. Calcium that has two borders there. With a lighter intensity in between the two borders, you won't be able to see it, and IVUS will always see it. IVUS sees it better. So this is the advantage with IVUS. IVUS will always tell you that calcium is there. And now we have a OCT based calcium scoring system, and this is by Fujino et al. Published in the Euro Intervention Journal 2018. And you look at, as I was saying, you look at the angle, the thickness, and the length of the calcium. Angle by angle, we mean the arc of the calcium. So if it is less than 180 degrees, it is not that significant because the vessel has scope to expand in one direction. If it is greater than 180 degrees, you give 2 points. You look at the thickness. If this is less than 0.5 millimeter, you can measure the thickness very well on OCT, which you can't do on IVUS. Okay, so they can afford this. And if it is greater than 1.5, it is 1 point. And length less than 5, 0 points, greater than 5. So you can have concentric calcium, but the length is also, it plays a part, a significant part in your assessment, and you're giving points to it. The most important, however, is the angle. So if it is 270 degrees or 360 degrees, this is very, very significant. And so we have a total score of 0 to 4 points. And as the score goes higher, the lesser is your likelihood of stent expansion if you haven't cracked the calcium.